The GOP's latest effort to repeal Obamacare could be on the brink of failure after Senator John McCain said he could not support this new Graham-Cassidy bill. Since Senator Rand Paul has already said he will vote no, it will only take one more Republican to come out against this legislation to kill it. Senators Susan Collins and Lisa Murkowski both voted no on that last repeal effort, you'll recall, and they have not revealed exactly how they plan to vote this time. So to say Congress is waiting for the senators' decisions with bated breath would be quite the understatement. But while we do, I want to bring in Lonnie Chen. He is the former public policy director for Mitt Romney and a research fellow at the Hoover Institution. Lonnie, I appreciate you coming on. I know you want to see the Republicans pass this Graham-Cassidy proposal. Why do you think this legislation is the right answer?
Well, Anna, I think it speaks to the two primary problems with Obamacare. The first is rising costs, which in many states we've seen year over year. It's making insurance unaffordable, unfortunately, for some Americans. And the second issue really is Obamacare took what was previously the province of states, really states regulating health insurance, and put it at the federal level. Those two problems are interrelated. And by the way, those two problems are issues that are directly addressed by Graham-Cassidy. So I do think that it would be a step in the right direction.
But let's take a look at how many don't want this legislation to go forward. These are just some of the major healthcare groups and insurers who oppose this bill. You also have the American Medical Association, so we're talking doctors, the American Academy of Pediatrics, pediatricians, the Nursing Association, nurses, and all 50 Medicaid directors say this bill would hurt people. Now compare that to the major healthcare groups and the insurers that support this bill. None. Not a single one that we could find who has vocally come out saying they support it. Even, again, the insurers are against this bill. So, Lonnie, how do you explain that?
Well, I would say, first of all, a number of governors have come out in favor. They think that it would give them greater flexibility to do good things. You're right about those healthcare companies and healthcare industry groups. What I would say is, look, I think people get used to doing things a certain way. They have gotten used to doing things under Obamacare. That's the regime they're used to. I can understand there are a lot of these groups that are not interested in change. But I also think that there are some serious problems that were created by Obamacare that do have to get solved. So it is unfortunate. You go back and you look at many different health reform efforts over the years. These groups have opposed many of those efforts as well. So I'm not entirely surprised this is where we are.
You talked about giving more power to the states. That is something that the Graham-Cassidy proposal would do, but yet you look at how that shakes out money-wise or funding-wise, and 34 states that get Obamacare money right now because of the Medicaid expansion would actually be getting a lot less money. In some cases, we're talking billions less, including in places like Pennsylvania, $6 billion less, Ohio, $9 billion less, Colorado, $6 billion less, Michigan, $8 billion less. How do these states make up for that kind of funding?
Well, one of the problems, Anna, created by Obamacare is you did have a lack of equality between states in terms of how much money the federal government was sending them. That was a problem to start with. In fact, whether they took this Medicaid expansion, this expansion of the program targeted at low-income Americans, whether they took that money or not, you're seeing unequal distributions of federal funding. So one of the things Graham-Cassidy tries to do is to equalize that. The other thing I would say is that a lot of these states, they're going to have to make tough choices regardless of whether we have Graham-Cassidy or not going forward, because healthcare costs are rising, becoming quickly unsustainable. States are going to have to make tough choices, and as it is, the Medicaid program in many of these states is crowding out spending on education, on the environment, on other important priorities. So these are decisions that are going to come home to roost regardless of whether Graham-Cassidy passes or not.
I want to play for you something Kellyanne Conway said about the Graham-Cassidy bill just yesterday. Watch.
Is it perfect? No. Is it the beginning of the end of Obamacare? You betcha. And you've got to be able to go home and look your constituents in the eye and say, when you had the opportunity and the chance to roll back what's wrong with Obamacare and help fill in those gaps of coverage.
So Senator Rand Paul, who we mentioned plans to vote no, addressed this line of thinking, saying, quote, "That's not a very ringing endorsement when people start out with it's better than nothing. They think that people just want us to do something and do anything." What's your response to that?
Well, I think, look, Senator Paul has said for a long time that he's interested in repealing Obamacare. At this point, what Republicans are trying to do is they're trying to use this budget reconciliation vehicle. We've talked about this before, because there isn't any Democratic support for getting rid of Obamacare. As a result, what they're putting through, by definition, is not going to be perfect. So I think Senator Paul, unfortunately, is allowing the perfect to be the enemy of the good here. We're all going to have different opinions, by the way, on what perfect is. I think the opinion that Kellyanne Conway was conveying is not unusual. I think all of us would love to see a different mix of things in the bill. That's not what we have. We have, at this point, a vehicle that I believe will improve the healthcare system, that I believe Republicans can pass, and I think that's what they should do.
Look, anything could happen. It looks like unlikely right now that this bill is going to move forward because of the math. But President Trump, we know, is not giving up. He tweeted this morning he thinks Rand Paul might just come around to voting yes. Do you think that's possible?
Anything is possible. I mean, honestly, it's very unlikely at this point, as you've said, that this thing gets passed because of the math, because we know that Murkowski and Collins have been opposed to previous iterations of the bill. Rand Paul's on record now saying he doesn't want to. I don't see how this happens, to be honest with you, but you never know. I mean, we didn't think we'd be talking about Obamacare repeal again, did we, after all the stuff that happened in June, yet here we are.
That's right. Lonnie Chen, thank you as always. And make sure you tune in to CNN Monday night. We have a special town hall that's going to